As President Trump pushes for passage of the GOP's overhaul of Obamacare, Governor Snyder is one of several state leaders pushing back. We showed you here yesterday. The governor sent letters to members of Congress, the Michigan delegation, urging them to vote no on the bill that would come up this week. Jason Colthorpe joins us now after speaking with the governor about his decision to put party loyalty second on this issue. Jason?
He really has, Devin, and part of that letter is a chart the governor attached to all of those, which runs down the list of all the Michigan congressional districts that he also sent to me, and basically it lists how many people in each district have Medicaid or Healthy Michigan plans, and he just wanted each of those members of Congress to know how many people would be affected. He says that plan, Healthy Michigan, has saved Michigan taxpayers money, but under the new health care plan, it would be gone. As another healthcare battle heats up in America, Governor Snyder wants to make sure Washington knows what's best for Michigan.
The Affordable Care Act needed to be reformed. There were some fundamental problems with it that do need to be addressed. And I just wanted to highlight there are some things that I haven't seen fully addressed in the legislation today that still need to be addressed in my view.
Things that would affect Michiganders, like eliminating Healthy Michigan, which provides health care to low-income families, keeping affordable premiums for people 50 to 64 years old, and Medicaid, specifically the costs of specialty pharmaceutical drugs.
So there are three major issues that I want to make sure I was highlighting to Congress to make sure they have it on their list of things that need to be addressed as part of hopefully reforming the Affordable Care Act.
Chuck Carney has good health care, but he hopes reform doesn't leave out the ones who don't.
I more think about the elderly people and them getting good health care and the coverage that they need.
The governor says it's too early to tell how much these things would hurt Michigan residents, but he has gotten preliminary feedback from some lawmakers.
We're talking people in their health care and their livelihood and their lives. So that's where I think it's important to speak up. So that's why I haven't been passive about this.
Healthy Michigan, by the way, which is an outreach from Obamacare, would go away because of the massive shift in cost here. The new health care plan would shift it from the federal government back onto the states, and eliminating that would put a burden of about $800 million back on Michigan taxpayers. Reporting live tonight, Jason Colthorpe, Local 4.